Infection Prevention and Control Precautions for COVID-19. Part 4. Personal Protective Equipment. Personal protective equipment. Specialized clothing or equipment worn by an employee for protection against infectious materials. PPE should be used based on the risk of exposure, will vary according to the setting and the type of personnel and activity. The overuse or misuse of PPE will have a further impact on supply shortages. All staff should be trained for proper use of PPE. Components of PPE. 1. Dressings, which include gown and coverall. 2. Cloth face mask, surgical mask and respirators. Surgical masks are in two types such as double layer and triple layered. Respirators are in three categories such as different grades of filtration capacity such as N denotes respirators are not resistant to oil, R denotes resistance to oil and P denotes to oil proof. 3. Gloves like disposable gloves, surgical or sterile gloves and utility gloves. 4. Head cap. 5. Footwear, which include shoe cover and boots. 6. Protective glasses like goggles and face shield. Special instructions for donning and doffing. Assess the job, process or procedure. Survey the work site and identify the hazards the worker will be exposed to while doing the work. List the PPE that will be used for each hazard identified. Employees required to use PPE must be trained before they are required to use the PPE. Retraining must be done if PPE requirements change and as needed. Wash your hands thoroughly before putting on and taking off the PPE. Follow manufacturer instructions and warnings. Make sure the PPE fits well. Disposable PPEs should not be reused. How to obtain PPE and how to dispose of PPE. Proper documentation. Articles for donning and doffing. Donning area, requirements. 1 chair or stool. Hand rub or hand washing facility. Adequate PPE. Micropore or adhesive tape. Checklist for donning. Proper color-coded buckets. Mirror. And display of donning steps. Doffing area, requirements. 2 chairs or stool, 1 dirty chair and 1 clean chair. Hand rub or hand washing facility. Extra gloves. Checklist for doffing. Proper color-coded buckets. Display of doffing steps. Special instruction for donning. Hydrate well. Eat well before donning. Use washroom if needed before donning. Hair should be tied up well. Spectacles should be tied well before donning. Leak test should be performed after wearing respirators. Avoid personal things like jewelry including wedding ring, watch, mobile phone, etc. Adjust PPE before going to the patient side. Range of motion to be checked prior and do show yourself to a buddy before moving to the patient side. Minimal touch to the patient care environment and other places. Special instruction for doffing. Do not make a hurry to doff. Sit in dirty chair if needed before doffing. If you are not feeling well, call for a buddy or assistant to help in doffing. Buddy must be in full PPE. Hand rub should be used in between each step of doffing. Do fold the gown inside out while removing and put it in the yellow bucket itself. Sit in a clean chair to remove shoe cover if needed. N95 respirator to be removed outside the doffing room in a separate bucket closed with lid. An extra bucket is placed for keeping the cap. The removed PPE must not lie on the floor. Take a bath after the removal of PPE. COVID-19 Guidelines on Rational Use of Personal Protective Equipment. This guideline is for healthcare workers and others working in points of entries, quarantine centers, hospital, laboratory and primary healthcare or community settings. The guideline uses setting approach to guide on the type of personal protective equipment to be used in different settings. Coronaviruses are a large family of viruses, some causing illness in people and others that circulate among animals, including camels, cats and bats. Rarely, animal coronaviruses can evolve and infect people and then spread between people, such as has been seen with MERS and SARS. The outbreak of novel coronavirus disease, now named COVID-19, was initially noticed from a seafood market in Wuhan City in Hubei province of China in mid-December 2019, has spread to more than 185 countries/territories worldwide including India. The causative agent for COVID-19, earlier termed provisionally as novel coronavirus, has been officially named as SARS-CoV-2. Mode of transmission. There is clear evidence of human-to-human transmission of SARS-CoV-2. It is thought to be transmitted mainly through respiratory droplets that get generated when people cough, sneeze, or exhale. SARS-CoV-2 also gets transmitted by touching, by direct touch and through contaminated surfaces or objects and then touching their own mouth, nose, or possibly their eyes. Healthcare-associated infection by SARS-CoV-2 virus has been documented among healthcare workers in many countries. The people most at risk of COVID-19 infection are those who are in close contact with a suspect or confirmed COVID-19 patient or who care for such patients. Personal protective equipment. Personal protective equipments are protective gears designed to safeguard the health of workers by minimizing the exposure to a biological agent. Components of PPE are goggles, face shield, mask, gloves, coverall or gowns, with or without aprons, head cover and shoe cover. Each component and rationale for its use is given in the following visuals. Face shield and goggles. Contamination of mucous membranes of the eyes, nose and mouth is likely in a scenario of droplets generated by cough, sneeze of an infected person or during aerosol generating procedures carried out in a clinical setting. Inadvertently touching the eyes or nose or mouth with a contaminated hand is another likely scenario. Face shield and goggles. Hence, protection of the mucous membranes of the eyes or nose or mouth by using face shields or goggles is an integral part of standard and contact precautions. The flexible frame of goggles should provide good seal with the skin of the face, covering the eyes and the surrounding areas and even accommodating for prescription glasses. Mask. Respiratory viruses that includes coronaviruses target mainly the upper and lower respiratory tracts. Hence, protecting the airway from the particulate matter generated by droplets or aerosols prevents human infection. Contamination of mucous membranes of the mouth and nose by infective droplets or through a contaminated hand also allows the virus to enter the host. Hence, the droplet precautions or airborne precautions using masks are crucial while dealing with a suspect or confirmed case of COVID-19 or performing aerosol-generating procedures. Masks are of different types. The type of mask to be used is related to particular risk profile of the category of personnel and his or her work. There are two types of masks which are recommended for various categories of personnel working in hospital or community settings, depending upon the work environment. Triple-layer medical mask and N95 respirator mask. Triple-layer medical mask. A triple-layer medical mask is a disposable mask, fluid-resistant, provide protection to the wearer from droplets of infectious material emitted during coughing or sneezing or talking. N95 respirator mask. An N95 respirator mask is a respiratory protective device with high filtration efficiency to airborne particles. To provide the requisite air seal to the wearer, such masks are designed to achieve a very close facial fit. Such masks should have high fluid resistance, good breathability, preferably with an expiratory valve, clearly identifiable internal and external faces, duckbill or cup-shaped structured design that does not collapse against the mouth. If correctly worn, the filtration capacity of these masks exceeds those of triple-layer medical masks. Since these provide a much tighter air seal than triple-layer medical masks, they are designed to protect the wearer from inhaling airborne particles. Gloves. When a person touches an object or surface contaminated by COVID-19 infected person, and then touches his own eyes, nose, or mouth, he may get exposed to the virus. Although this is not thought to be a predominant mode of transmission, care should be exercised while handling objects or surface potentially contaminated suspect or confirmed cases of COVID-19. Nitrile gloves are preferred over latex gloves because they resist chemicals, including certain disinfectants such as chlorine. There is a high rate of allergies to latex and contact allergic dermatitis among health workers. However, if nitrile gloves are not available, latex gloves can be used. Non-powdered gloves are preferred to powdered gloves. Coverall or gowns. Coverall or gowns are designed to protect torso of healthcare providers from exposure to virus. Although coveralls typically provide 360-degree protection because they are designed to cover the whole body, including back and lower legs and sometimes head and feet as well, the design of medical or isolation gowns do not provide continuous whole body protection. For example, possible openings in the back, coverage to the mid-calf only. By using appropriate protective clothing, it is possible to create a barrier to eliminate or reduce contact and droplet exposure, both known to transmit COVID-19, thus protecting healthcare workers working in close proximity, within 1 meter, of suspect or confirmed COVID-19 cases or their secretions. Coveralls and gowns are deemed equally acceptable as there is a lack of comparative evidence to show whether one is more effective than the other in reducing transmission to health workers. Gowns are considerably easier to put on and for removal. An apron can also be worn over the gown for the entire time the health worker is in the treatment area. Coveralls or gowns have stringent standards that extend from preventing exposure to biologically contaminated solid particles to protecting from chemical hazards. Shoe cover. Shoe covers should be made up of impermeable fabric to be used over shoes to facilitate personal protection and decontamination. Head cover. Coveralls usually cover the head. Those using gowns should use a head cover that covers the head and neck while providing clinical care for patients. Hair and hair extensions should fit inside the head cover. Rationale use of PPE. The PPEs are to be used based on the risk profile of the healthcare worker. The document describes the PPEs to be used in different settings.
Now we will see rational use of personal protective equipment in various settings. At the point of entry, we will examine what kind of personal protective equipment is required at various stations. At the help desk, risk of exposure is considered low and personal protective equipment required at the help desk is a 3-layer surgical mask and gloves. The staff deputed in the help desk must maintain a distance of 1 meter while providing information to the travelers. Key points to be noted while at the help desk is you are wearing 3-layer mask, gloves and maintain a distance of 1 meter. At the immigration counter, customs and airport security, risk of exposure is considered low, and personal protective equipment required at these stations is a 3-layer surgical mask and gloves. The staff deputed in these stations must maintain a distance of 1 meter while providing necessary services to the travelers. Key points to be noted while at these stations are, you are wearing 3-layer mask, gloves and maintain a distance of 1 meter. At the temperature recording station, the risk of exposure is considered low. Personal protective equipment required at this station is a 3-layer surgical mask and gloves. The staff deputed in this station will assess the temperature of the traveler using a handheld thermal recorder. Points to be noted while at this station are, you are wearing 3-layer mask and gloves.
There is a moderate risk of exposure in the holding area. The isolation area of the Airport Health Authority. The isolation area of the Port Health Authority. The doctors and nurses or staff deputed in these stations must wear N95 mask and glove while performing a clinical examination or while conducting an interview of the traveler. The key points to be noted are the use of N95 mask and glove
in the isolation facility of the Airport Health Authority or in the isolation facility of the Port Health Authority. There is a moderate risk of exposure while providing routine clinical services. The doctors and nurses must use N95 mask and glove in the setting where there is moderate risk. In the isolation facility, when the staff are rendering services to a critically ill client, the risk of exposure is high, and the staff must anticipate that the chance for aerosol-generating procedures may need to be performed in an emergency. The staff must use full complement personal protective equipment. Key points here are: when in moderate risk, the staff must use N95 mask and glove. When the risk of exposure is high, then the staff must use fully complement personal protective equipment.
The housekeeping staff posted in the point of entry has to clean frequently touched surfaces and other housekeeping activities, which exposes them to a moderate risk of infection. They must use N95 mask and glove. The administrative staff posted in the point of entry are to provide administrative support. They do not have any contact with patients, and they are not supposed to venture into areas where COVID-19 suspected cases are managed, and the risk of exposure is very minimal. They do not need to wear any personal protective equipment. Now we will look into the rational use of personal protective equipment. To begin with, we will analyze the use of personal protective equipment in the outpatient department. In the triage area of the outpatient department, there is a moderate risk of exposure and the staff must use N95 mask and glove. A 3-layer mask should be provided while the patient arrives in the triage area. And also must ensure that the patient is wearing the mask. In the registration area or at the help desk, the risk of exposure is moderate and staff deputed at these areas must use N95 mask and glove. In the temperature recording area, the staff deputed in this area have a moderate risk of exposure while assessing the temperature of the patient using a handheld thermal recorder, and they must wear N95 mask and glove and also ensure the patient is wearing the 3-layer mask. While in the holding area or the waiting area, the nurses or the paramedic interacting with the patients have a moderate risk of exposure and they must wear N95 mask and glove and also ascertain that a distance of 1 meter is maintained while interacting with the patients. In the examination room or in the doctor's room, the risk of exposure is moderate. Only if aerosol-generating procedures are not being carried out, and the staff in the room must wear an N95 mask and glove. The housekeeping staff has a moderate risk of exposure while they are cleaning the frequently touched surfaces or other housekeeping activities, and they must use N95 mask and glove.
Visitors who are accompanying children and elderly have a low risk of exposure. The visitors must maintain a distance of 1 meter and should practice frequent hand hygiene and must wear 3-layer mask. No other visitors should be permitted to enter the outpatient department. Ensure that a separate triage system is established to screen influenza-like illness. If such a system cannot be established because of various factors, then precautions must be taken in the general outpatient settings. Now we can look into how the personal protective equipment is used in the inpatient service area. In the individual isolation room or in the cohort isolation room, the risk of exposure is moderate and the patient must use a face mask. The staff should use N95 mask and gloves. The staff deputed in this area must ensure that aerosol-generating procedures are not performed in these areas. While in the ICU, in the critical care area, risk of exposure is high and staff deputed in these areas must use full complement personal protective equipment. The risk of exposure is high while handling and packing the dead body in the body bag, and the staff deputed for these activities must use full complement personal protective equipment. While transporting the dead body packed in the body bag to the mortuary, the risk of exposure is minimal, and the staff deputed for these activities must use a 3-layer mask and gloves. For the housekeeping staff, the risk of exposure is moderate as they are cleaning the frequently touched surfaces. The housekeeping staff must use N95 masks and gloves. While in other areas of the hospital, make sure that there is no mixing of the COVID patients with other patients. The risk of exposure can be estimated on the basis of patient profile who approach those areas. The personal protective equipment used on non-COVID-19 areas of the hospital is based on the infection control policies of the hospital. While the caretakers who are accompanying the patient for hospital care are having a low risk of exposure, they must use a 3-layer mask. Practice frequent hand hygiene. Always maintain a distance of 1 meter. Now we can see the strategy of personal protective equipment use in the emergency department. While you are dealing with routine emergencies, the risk of exposure is moderate. The staff deputed in these areas must use N95 masks and gloves. Aerosol generating procedures can be anticipated. If you come across a patient with severe acute respiratory illness, the risk of exposure is high. The staff managing the patient should use full complement personal protective equipment. In the table shown here, we can see what all situations which type of personal protective equipment must be used by the ambulance drivers. The ambulance drivers pass through low, moderate, and high risk of exposure based on the profile of the patient being transported. If the driver is transporting a general patient, the risk of disease transmission is low. The drivers must wear a 3-layer mask and gloves. The risk of disease transmission increased to moderate, while the driver is transporting a patient with ventilator assistance. On that occasion, the driver must wear a N95 mask and glove. While the driver is transporting a patient with severe acute respiratory illness, the risk of exposure is high. Full complement personal protective equipment should be used by the driver. For the laboratory staff, the risk of exposure is very high. They should wear full complement personal protective equipment. It doesn't matter whether they are collecting, transporting or testing the sample in the morgue. While handling the dead body, the risk of exposure is moderate. The staff deputed in this area should use N95 mask and glove. And staff must ensure that aerosol generating procedures or embalming procedures are not performed. If an autopsy is performed, the risk of exposure is high. Staff should wear full complement personal protective equipment. The housekeeping staff, who are cleaning the frequently touched surfaces, linen, floor, etc. For them the risk of exposure is moderate. The housekeeping staff should wear N95 masks and gloves. The staff deputed in the central sterile service department or in the laundry, while handling fomites and other articles, they have a moderate risk of exposure. To reduce disease transmission they should wear an N95 mask and glove. Other supportive sector staff like finance staff, administrative staff, engineering staff, etc. They have no possibility of exposure to COVID patients. As they have no exposure to COVID patient, they have no risk for disease transmission. They do not need any personal protective equipment. However, hospital administration must ensure that other support staff should not venture into COVID-19 treatment areas. Now we will see what type of personal protective equipment is required in the community setting. The field surveillance team comprising of ASHA worker, Anganwadi worker, and other field staff have a low risk of exposure. Personal protective equipment requirement of the field surveillance team is a 3-layer mask and gloves. The field surveillance team must ensure that they maintain a distance of 1 meter. They should carry adequate triple-layer masks to distribute to suspect cases identified during field surveillance. Doctors who are conducting field-level clinical examination, they have a moderate risk of exposure. They must use N95 mask and glove. In the quarantine facility established at the community, both the staff deputed there and person quarantined in that facility have a low risk of exposure. Personal protective equipment required is a 3-layer mask and glove for the staff. For the person who is quarantined, personal protective equipment required is a 3-layer mask. Healthcare staff performing an examination of the quarantined person have a moderate risk of exposure. Personal protective equipment required for them is N95 masks and gloves. While the support staff in the quarantine facility have a low risk of exposure, personal protective equipment required for them is a 3-layer mask. Now we will see the personal protective equipment required in home setting. For the person who is in home quarantine as well as for the caretaker, risk of exposure is low. While cleaning the frequently touched surfaces and linen, the personal protective equipment required for the caretaker is a 3-layer mask and glove. While for the person in home quarantine, personal protective equipment required is a 3-layer mask. For all other family members in the household, risk of exposure is low. They don't need any personal protective equipment. But he must ensure that they must maintain a distance of 1 meter from the person in home quarantine. Senior citizen and other vulnerable population in the household should be kept under reverse quarantine.
Points to remember while using PPE. PPEs are not an alternative to basic preventive public health measures such as hand hygiene, respiratory etiquettes which must be followed at all times. Always, if possible, Maintain a distance of at least 1 meter from contacts or suspect or confirmed COVID-19 cases. Always follow the laid-down protocol for disposing of PPEs as detailed in Infection Prevention and Control Guideline available on website of Ministry of Health and Family Welfare. PPE specifications for contact and airborne precautions. PPE kit. Gloves. Nitrile. Non-sterile. Powder-free. Outer gloves preferably reach mid-forearm, minimum 280 mm total length. Different sizes are available like 6.5, 7 etc. Quality of the PPE with below standards: coverall, medium and large. Impermeable to blood and body fluids. Single use. Avoid culturally unacceptable colors, for example black. Light colors are preferable to better detect possible contamination. Thumb or finger loops to anchor sleeves in place. Quality compliant with following standard. Meets or exceeds ISO 16603 Class 3 exposure pressure, or equivalent. Goggles. With transparent glasses, zero power, well-fitting, covered from all sides with elastic band or adjustable holder. Good seal with the skin of the face. Flexible frame to easily fit all face contours without too much pressure. Covers the eyes and the surrounding areas and accommodates for prescription glasses. Fog and scratch resistant, adjustable band to secure firmly so as not to become loose during clinical activity. Indirect venting to reduce fogging. May be reusable, provided appropriate arrangements for decontamination are in place, or disposable. Quality compliant with the below standards, or equivalent. N95 masks. Shape that will not collapse easily. High filtration efficiency. Good breathability, with expiratory valve. Quality compliant with standards for medical N95 respirator. NIOSH N95, N149 FFP2, or equivalent. Fluid resistance, minimum 80 mm of mercury pressure based on ASTM F1862, ISO 22609, or equivalent. Quality compliant with standards for particulate respirator that can be worn with full face shield. Shoe covers. Made up of the same fabric as of coverall. Should cover the entire shoe and reach above ankles. Face shield. Made of clear plastic and provides good visibility to both the wearer and the patient. Adjustable band to attach firmly around the head and fit snugly against the forehead. Fog resistant, preferable. Completely covers the sides and length of the face. May be reusable, made of material which can be cleaned and disinfected, or disposable. Quality compliant with the below standards, or equivalent. Triple layer mask. 3-layered medical mask of non-woven material with nose piece, having filter efficiency of 99% for 3 micron particle size. ISI specifications or equivalent. Use of gloves and standards are as follows. Body bags. Specifications should be impermeable, leak-proof, air-sealed, double-sealed, disposable, opaque, white, U-shaped with zip, 4 or 6 grips, size 2.2 by 1.2 meters. Standards. All items to be supplied need to be accompanied with certificate of analysis from national or international organizations or labs indicating conformity to standards. All items, expiry 5 years. Due to scarcity of coveralls, and risk versus benefit, that as an emergency temporary measure in larger public interest, in present given circumstances, the fabric that cleared or passed synthetic blood penetration resistance test, ISO 16603, and the garment that passed resistance to penetration by biologically contaminated solid particles, ISO 22612-2005, may be considered as the benchmark specification to manufacture coveralls. The coveralls should be taped at the seams to prevent fluid or droplets or aerosol entry. The test for these two standards, ISO 16603 and ISO 22612 to 2005, which can be performed in Indian laboratories, are as per World Health Organization Disease Commodity Package. Thank you for listening the presentation.